करिए, शुरुआत करिए।
विघ्नेश्वराय वरदाय सुरः प्रियाय लंबोदराय सकलाय जगद्हिताय नागाननाय श्रुतियज्ञ विभूषिताय गौरीसुताय गणनाथ नमो नमस्ते। कर्पूर गौरम करुणावतारम संसार सारम भुजगेन्द्रहारम सदा वसंतं हृदयारविंदे भवं भवानी सहितं नमामि। या कुन्देन्दु तुषारहार धवला या शुभ्रवस्त्रावृता या वीणा वरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्मा च्युतशङ्कर प्रभृतिभिः देवै सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा। सर्वमङ्गलमाङ्गल्ये शिवे सर्वार्थसाधिके शरण्ये त्र्यम्बके गौरी नारायणी नमोस्तुते। आविर्बभूव कलशं दधदर्ण वाद्यः पीयूषपूर्ण ममरात्वकृते सुराणां रोगजालजीर्ण जनता जनितः प्रशंसो धन्वन्तरिच भगवान् भविकाय भूयात्। श्री धन्वन्तराय नमः। ओम शांति, ओम शांति, ओम शांति।
Namaskar. We would like to welcome you all on our 1013th webinar. Thank you very much for joining us today. I would like to communicate my sincere regards to Dr. Karthikeyan Natarajan sir. Welcome sir. Yesterday we were unfortunate that we could not have your blessings in detail. So we are here. I would like to welcome Vaidya P.K. Prajapati ji. Welcome. Vice Chancellor Dr. Sarvapalli Radhakrishnan, IRES University, Rajasthan. Welcome Dr. Prajapati ji and our Agnihotri. Without wasting much time, I would like to invite Professor P.P. Sharma ji for his welcome blessing. Prajapati ji, namaskar.
नमस्कार नमस्कार सर, नमस्कार।
हाँ, उद्घाटन आपके शब्दों में ही है।
हम सुनने के लिए आए हैं आज।
अच्छा, ठीक है। आदरणीय बीपी शर्मा सर।
हाँ, थैंक यू। नमस्कार। Good evening to everybody. Respected distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to this evening webinar on mental health care for autism. Most important subject today we have. We have eminent speaker. I want to welcome Dr. D. Karthikeyan, renowned ENT surgeon, founder, DOS Clinic, Chennai. Namaskar, sir, and welcome you to this evening webinar. Next, I want to welcome Dr. Prasanna Sia, dentist, team member, DOS Clinic from Chennai. Namaskar and welcome you to this evening webinar. Once again, I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this evening webinar on mental health care for autism. Thank you. Namaskar.
Thank
Over
you
to
very much.
Pawan.
Now I would like to request Agnihotriji for brief preamble.
Thank you, Professor Pawan Sharma ji, and welcome to all the dignitaries of today's webinar, along with all the great distinguished dignitaries present on today our webinars platform. As we are in the continuation of the yesterday's webinar, the topic is very clear regarding the mental health and how it can be maintained apart from some physical activities. So here we are to listen what sorts of shortcomings happens when a person
Autism, today we are
yes.
for autism.
So the autism is how it can be taken care of, because impaired situation of the activities, thinking, dieting, management, walking, everything is disturbed to such persons. So here are the guests. They will throw light over the such conditions and how it can be managed, or what are the challenges to the family who have got such candidates having such type of shortcomings. So our guests are here to throw light over all these such conditions, persons suffering from autism. So I just welcome all the guest speakers and eager enough to listen the knowledge from them. Thank you, sir. Thank you, and over to Professor Pawan Sharma ji.
Thank you, sir. Now I would like to request Dr. Karthikeyan Natarajan, sir. Please bless us. Thank you.
Good evening to the august audience, all of you, and my respect to Dr. Pawanji for the confidence with which he has invited me to talk today. And I remember him asking me to talk on Autism Day also. And for the mental health also, Ms. Pawanji has asked me to talk. That shows how much autism is important in the minds of the physicians and the parents. Autism, if you split it, it is called autoism. That is, one person is driven inside. And that is why we tell the children are inside a bubble. When I am speaking for about 30 minutes, sometimes you may think that I'm a little optimistic, I'm a little pessimistic, and I'm a little blowing my trumpet and all this kind of thing. I want the audience to bear with me. Because I'm going to say, even Pawanji is autistic. Because it is autoism. For 3 years, he has been conducting daily webinars, which are beamed all over, and he invites speakers, chooses them, and then requests them to talk. So his mind is in this webinar. So 24 hours of the day, all his cells are vibrating about this webinar. That is autism. That is the mind, because there is no definition about the anatomy or the physiology of the mind. Physiology, you know. But if you ask anybody, where is the mind situated, they'll all be confused. They'll say it is subconscious and conscious, prefrontal area, heart, all these things will be mentioned. Sometimes I was saying it is the brain is a hardware and the mind is a software. Even I was not satisfied with that answer. Now I tell them the mind is in the cell. Because if you clone Mr. Pawanji, even the clone will conduct webinars because it is in this cell. Cell to molecule, molecule to the structures, structures to the brain. So such way, I am also autistic. I've been thinking about autism for the past 20 years. And because Pawanji is autistic, when I spoke yesterday, he thought I should talk again. Because he's also thinking about autism in a big way, and he thought what was given was not enough. So thank you so much. I'm going to paint a different picture about autism because the topic is care for autism. It is not care for autistic people or autistic individuals or autistic children. It's care for autism. So the topic refers to the condition and not the individuals. So he knew that autism is omniprevalent all over. We are all autistic at times, and we come out from the autistic tendencies with our neurotransmitters and chemicals, and especially serotonin. And I don't have to talk about serotonin in an audience of Ayurvedic physicians because yoga, oleation, everything talks about serotonin and you know about it. Now, where do I begin? Where do the care begins? See, one professional used to tell, autistic children are happy as they are. We are only bothered. The autistic children consider that we are aliens in their world. And we consider that they are aliens in our world. But when I refer to Pawanji that he is autistic, or when I refer to me as autistic, we have a purpose to serve. But unfortunately, the children also have a purpose, but they are not able to communicate to us that this is the purpose I am doing this. Supposing we identify the purpose and then get them into a productive field, that will be good. That is what we are trying to do for the past 20 years. And that is what is the label which brought me into this forum. Otherwise, I'm not an Ayurvedic physician. I am neither a yoga doctor, all these things. But the autism is the molecular denominator which has related us, or which has given, which got me married to you. Okay. Now, where do we begin the care? The care has to be for the parent because they are put into a lot of hardship. This was mentioned yesterday by Prasanna Shriya. And over the years, I see a lot of, plus points, negative points, plus parents, negative parents and all that. I'll just tell you a real example which happened day before yesterday. See, after about 20 years of our activity, we are able to run an outpatient program for these children with autism. The autism is a worldwide problem because it does not have a biological marker. And when I began my journey 20 years back, it was very, very difficult. Diagnosis was difficult. Which is the professional who will be able to diagnose autism, which is the age in which the autism should be diagnosed, after which where should the autistic children go for care. Everything was a confused phenomenon. And that is why actually the Western scientific people declared that autism is hardwired and it cannot be rewired. So we took it as a challenge to kind of rewire the autism, and then they actually looked at me as a lunatic, that it cannot be done. But I had a lot of faith in the traditional Indian systems of medicine that they can deliver the results. So that is way back in history, and then coming to the recent month. So we have a lot of improvement in the children who are subjected to the early intervention program, which is biological. We change their dietary pattern, change their lifestyle, and then give some supplements. To our own surprise, we found that these children respond within about a month. A child who is hooked onto iPad is able to leave the iPad and it is not adamant in asking for an iPad. A child who is hooked to a particular junk food is possible. I mean, the parents are saying like it is possible for us to keep him away from that junk food. So we knew that the brain can be rewired, or the cells and the molecules in which the child is made up of, we are able to make a change. So now coming to the interesting part, we had one child treated from a place about 20 kilometers from Chennai, suburbs of Chennai. And the child was put on a dietary therapy and then some supplements. And after about a month, that parent told us that we have remarkable changes in our son. The eye contact is better. His name call response is better. This boy is around 6 years old. And after that, we had a phone call from another parent from the same vicinity. We asked the parent, who is the reference? I mean, who told about us? It was interesting that this mother told us the maid who is working in both the houses told us that the boy in the next house where they work, where she works, she has seen improvement in that boy. So you take your son to those. So that was quite interesting because we have references through web, we have references through doctors to doctors and parents to parents, and possibly this is the first time it has come from a maid. That means how the autistic manifestations are seen by the common man or even a maid, and she is able to identify there is something different in this individual, and they don't fit in with the society. They possibly the maid was used to cleaning up the mess that the child was doing. And then the child did not do a mess, and then she thought the child is improving. At the same time, we had a reference from far away, from a place near Coimbatore. It was kind of damaging to us. This boy, around 5 years old, has undergone an adenoidectomy and a tongue tie release by a surgeon who promised that the child will speak after the surgery. The child has autism. And after that, the child has gone to one other school. The headmistress is my patient, and she immediately told them to come and see us. This talks about the confusion in the minds of people in the society, caregivers, doctors, everybody. And again, don't mistake me, this has become a big industry where you can make money out of these children. So again, coming to the topic of care for autism, where do we start the care? The parents' health. The parents' health is of paramount importance because every parent thinks, what will happen to my child after me? And that has to be taken care of. And that is the, the prime reason why, being an ENT surgeon, I jumped into this particular field of taking care of autism, or taking biological care of autism. We are talking about autism in this forum of physicians, and it is a mixed forum where some of my professionals are there, and then some parents might be there. And this message has to go into the society that this problem should be managed biologically, Because as I told you, it is the brain which is inflamed, and it is affecting the emotional quotient of the child. And that interferes with the intelligent quotient of the child. And because the emotional quotient is not proper, the intelligence is not coming out. And on the introduction, The professor told that they are not able to move their limbs and all that because the central command is in trouble. The central command is inflamed and the neurons are not communicating within themselves. And that is the reason why the child is manifesting the problems. Still, most of the world is looking at autism in a symptomatic way. They are not looking at autism in the biological way. And looking at the history, many people have done endoscopies to prove that these children have inflammatory bowel disease. And the pain of the inflamed bowel is not being expressed by the child because the child is non-verbal. That shows tantrums that is taken as autism and it is managed possibly improperly. I wouldn't say that we are the only group who are properly managing autism. I'm saying this has to go around. And that is when the care of autism will have the meaning. Now, I'm looking at the topic in a different way also. We are trying to treat children with autism to make them a productive, independent individuals. I also practice my ear, nose, throat. I find children nowadays turning autistic. That is a kind of a sickening situation. Most of our children are addicted to junk food, addicted to gadgets, addicted to mobile phones, tablets, and they listen to music through headphones. Thereby, they lose their sleep. They remain awake most of the night and then wake up very, very late in the morning. And these children who are neurotypically normal are showing evidences of late name call response. And most of the time their mental acuity is not up to the mark. Many of the parents complain that they don't do well in the studies. And it is an unfortunate situation. Many such children in the age group of 12 to 18 seek the help of psychologists and psychiatrists. I am not exaggerating. This is happening in our society. And we cannot shut our eyes and say, this is not happening in my compound, why should I bother? Because it is part of the society, it is happening and it is going to blow. On one side, we have children with autism. The incidence is rising. The statistics are rising. We rely on US statistics. We don't have a reliable Indian statistics because of so many problems, so many languages spoken, 52 or more than 52 kind of languages spoken, and we cannot, translate the questionnaire for autism assessment into all the different languages. And then when it is translated, the meaning gets distorted, all these kind of reasons. But ladies and gentlemen, it is not the question of statistics. When I was in US, I was in a dean's office and we were with a psychiatrist. And the dean introduced me to that psychiatrist saying like, he is a doctor from India and he is doing treatment for autism through the Indian medical systems. And the psychiatrist actually threw a very sarcastic look on me. And he looked down upon me. And he said like, the dean asked the psychiatrist, do you think the numbers of autistic children are growing? And the psychiatrist was an American. He said like, no, I don't think, because these Silicon Valley intellectuals beget children who behave a little different, and all of them are put into a basket of autism. So I don't think it is actually increase in the incidence, it is an apparent increase. Then the dean looked at me and saying like, Dr. Karthikeyan, what do you comment on this? I said, sir, I'm not looking at statistics. If one family has a child with autism, it is a lifelong sentence for them. It is a lifelong suffering for them. When you have riches to rags story, we have a lot of rags to riches story in autistic families. So statistics does not matter. We have to take care of each and every individual family and then bring peace to them. The dean was very pleased with my answer. He said, like, I like your answer and I like your emotive approach to this. So even before that, we only look at the emotional component of autism. If we improve the emotional component of the autism, things will improve. And we are seeing in every child of us, the emotive component when it becomes better. You should see the smile and happiness in the parents' faces. We had a recent child included in our outpatient program. They come for every month review. Because we don't have a biological marker, we have to rely on the physiological markers and the behavioral history that the parents say. The mother said, they have a 1.5-year-old child also. Earlier, he used to just push the child and go away. He will not bother if she is on the way, but now he cares for us, cares for her. And then when he passes by her, he is a little more careful. See, that is one indication of the child improving. One indication of rewiring happening inside the brain. One indication of coherence of functional areas happening inside the child. So that is the way we improve. And that is the way we want to move forward. Yesterday, I told you we have entered Bangalore. I wanted to enter Bangalore for many years because that is where the nuance is, and that is where I presented a concept that the brain is secondarily affected after the gastrointestinal system. Earlier, that was in 2007, they didn't agree to it because there is always a controversy between the cause and the effect phenomena in autism. Again, because we don't have a biological marker. Now we are entering Bangalore because of a lawyer. You will be surprised we are not entering because of a medical personnel. A lawyer who runs a international school, and he got cured of his L4, L5 problems through an Ayurvedic physician. So he got interested in Ayurveda about 10 years back. He built a hospital of Ayurveda, and then he invites people from Kerala to treat people in Bangalore, Electronic City. And he saw children with autism in a school, and then he wanted to treat them. And then he had a talk with us, and then he has invited us, and we are going to establish the unit. We have already launched, announced the launch, and then we are going to start a day after tomorrow. So what I'm saying is the care of autism should go beyond the boundaries of the child, the parent, the family, and it has to go into the society. People are not aware, and they think it is. They ask me several questions. Is it Down syndrome? Is it mental retardation? Is it CP? And all this kind of thing. Still the complete awareness has not come. And again, because there are a lot of treatments which are advocated, lot of, confusion in the nomenclature, which is the treatment, which is the therapy. This is going on. Ladies and gentlemen, autism is a chronic, dynamic, reversible encephalopathy. This is the new term with which we are working. It has got a pathophysiology, it is not a syndrome, and it has got a pathophysiology and it could be treated. And the emotion and the stress controls it. The emotion and stress, if it is in the pregnant lady, this can cause autism in a big way. The rising numbers of autism could be the environmental factors, the dietary factors, the pesticides, the damaging pesticides and insecticides. It could be anything. But please remember, the run behind the money, the run against the time is causing a lot of damage in the neurotypical man and female in a family. And when the female becomes pregnant, they have to be very, very careful so that they beget children who are healthy and not autistic. Now I invite Prasanna Shriya. She has done a study on the impact of the conceptual methods on the pregnant woman and the outcome, the children. Prasanna, please come in, you share your views, and then let us create a society in which the autism child is taken care of properly and the autism related population is taken care of properly, and we at least reduce the number of children with autism coming into this world. Over to Prasanna Shriya, please.
Thank you, sir.
Thank you, sir.
Good evening, respected doctors, my fraternity over here. Thank you, Dr. Karthikeyan, and thank you, Ayush, for giving me this opportunity to speak. I'm really overwhelmed. I have a lot to speak, and as usual, it's so less time. I would like to start with what Sir beautifully said. He said that, where is the mind? I mean, even to ask ourselves, where is the mind? Most of us wouldn't know where the mind is. We would search for it. And being in the current scenario of what you call as 2020 kids to the COVID kids, we have a lot of tags, hashtags of Twitter and Instagrams. We are living in such a scenario of what you call as media, social media. We need these to take our, I would not even call it a struggle, but for 20 years of hard work that we are doing, and Pawanji for creating the webinar reach outs. So thank you. With this thank you note, I start my presentation. I feel when I came into doing my master's and my study was a pilot study for centers in Chennai to understand the diagnostic methods, the therapies that they gave, and the common neurological comorbidities in children with autism. I mean, this is the thought with which I even entered. And we always say, no, once you enter, it's like an abyss or it's like a labyrinth. It just keeps going in more and more. And sometimes you even forget to what you are even coming for your own purpose of your project. So sometimes I would come back and stick to my project and again, get myself to be sucked into this, what I'm looking at it. It was an ocean. And many things were what you call as red flag. We saw red flags. And one such thing is what Sir pointed out. We found there were women, a late childbearing age. And we really don't know the reason why they didn't bear child, but the child which was born to them or born to them later was through what you call as not the natural way, but what you call as a therapy, a hormonal therapy or fertility therapy. I mean, I see a lot of fertility centers around Chennai, everywhere, wherever we go. And I'm not trying to be very conclusive about what I'm speaking, but it was glaring. There were women from 24 to 40 in our study that we did. And most of the younger women were fine enough. But as the age grew, we found the women who were bearing child, and it was through the ways of going to a fertility center. So what you call as assistive reproduction. And I'm not even sure how much of what they were going through did the doctors actually say. I would always say, no, there's a flip side to everything. Nothing is 100% good, nothing is 100% bad. Like what we say as we need 2 hands to clap to make the noise. Otherwise, we can do a clap like this, a noiseless clap. So I found that most of them were not even told into what they were going into. So this is like you do a tapas and God comes in front of you and he asks, what do you want? And very innocently we say, we want a child, and God gives, so be it. You have it. And I think that's what most of them, I'm a allopathy practitioner. I think that's what they did without giving the consequences or the pros and cons. There are few people whom I know who are in their early 30s now, being wise enough after seeing what's happening around them, they ask questions. I've been given a medicine. What is this medicine going to do? Doctor, I've come to your clinic but to have a natural conception. I don't want any pill or any assistive reproduction. I don't want my husband's sperm or my egg to be even in a surrogate way. So to this level, a person has to be awakened, or as a fellow practitioner or a human to human. You needn't even call yourself as a doctor, a fellow human being, to say a pros and cons of everything what we do. So this is one aspect what we found, where most of the assistive reproductive, the mothers who had gone had issues with the child being born with autism. Again, I'm trying to be very inconclusive. I'm not concluding, that is the one. And Sir spoke about caregiving. So my question is, when does the caregiving start? Where does the caregiving start? How does the caregiving start? And Sir again beautifully said that the moment we realize that the ladies become pregnant, you're so happy. It's like Dhoni hitting a sixer. But should that alone be seen at all? So my research with the Autism Center made me think, and I added features like what you call prenatal, postnatal, perinatal. How was the mother's status, her mental health? Did she undergo any sort of psychological stress? They say even pregnancy per se is stressful because it's so much of bodily physiological changes that happens. It's like you're growing something, initially a fetus, which turns to be a human in your womb. If it develops fully, yes, we call it as a baby and it's delivered. If it's not, nature has its own way of getting it aborted too. I was taught by my genetic ma'am, Sri Kumari ma'am. She says, nature has the beautiful way, Shreya. It eliminates. Mother Nature eliminates what is not to be. The uterus is yours, where you bore the child. But if it's not going to be healthy, 90% gets eliminated like that. But what happens, and how are so many being born? Then we found out there are mental health illnesses in the family running. So we started with the genetic, we started drawing the pedigree tree. And the mental health can be in any form. And one aspect what we found was even epilepsy to be there. So when you ask, again, the question of mental health and caregiving, it becomes a very, very vast subject, because I wanted to lend my hand. And finally, I felt like a lost child. I had just 2 hands and not more than that. But I wish I was Ravan on that particular day when I started my project, because I wanted to lend my hand to the mother. I wanted to lend my hand to the doctor. I wanted to lend my hand to the child with autism. And caregiving for the mother who's in denial, for the family who's in denial, for the couple who are in denial. Where are we going to start? How am I going to start? How am I going to make them understand? At the same time, telling them, I am with you in this journey. You're not alone. People come with us during our inquiry. They come up with lost faces. They go out with hope. And as doctor said, when people see the change that's happening, we really see them coming back to us and with a broad smile, and they say, we never expected it. And the miracle happens from then on, which means they truly believe not only in the system, they believe in their belief and in our belief and in the child's belief. Till then, no, they just find the behavior very odd. They never see what is the trigger. My child is not doing this, or he's doing something very inappropriate. But when we go in further to dwell, why is your child doing this? So you need to give caregiving even in there. We think, no, most of the time, like everything is taken for granted in life. When I went through this journey, my project time was only 6 months. But when I came out, no, for me, it was an awakening. I felt to be born normal is so abnormal. And that day I knew, I mean, much before I knew, I was not normal. But it became very conclusive. None of us are normal. But how do we think that we are so normal? And like doctor said, no, we don't want in our own society to have them as an inclusive society. We always try to say something is not right. When we say something is not right, then where will the caregiving come? And doctor beautifully again quoted and spoke about referrals. We had a broad smile when this referral came to us through the housemaid, which means she is observing so much what's happening in the entire family, not just with the primary caregiver, which is the mother. And especially in autism, I would like to put within bracket, the entire family goes under anxiety, depression, various forms of stress level every day, day in and day out. So at least I would know if I have a child, he's about 17 years, okay, he's finished this part. We think academics is important and we worry over academics and that's over. Okay, next college, that's over, next. So we bring in our worries. Here, they don't bring in the worry. They live with the worry, not knowing what is going to happen to my child after me. From the time the diagnosis happens as ASD, the parents' only fear is what happens after me. And till today, we are not able to give an answer to that, but we are able to take the patients and the family in our journey for them to give a small, what you call as snippets of smile. When they come and tell, sir, my child did this, there was a name called response. He is able to recognize there is a smile, there's a meaningful smile. Now, the parents are beginning to notice, even the parent who would otherwise feel, no, I don't know what I'm going to do. This is like what you call as a basket case. No, I'm shouldering my child. He's 17 years. I've been shouldering him for 17 years. But when they start seeing the change, there is a smile. There's a meaningful smile from the parent too, with the belief, yes, we can do it. And that gives us a sort of as a hope and a relief for us to say, yes, we are in this journey together and we had been together. And it's like a 4 into 100 meters relay. I'm a sports person. I connect and relate everything to sports. So the child with autism is like the baton I run 100 meters or 400 meters and give the baton to the next person. Yeah, the family runs. And we'll have to keep the family and their mental health at most primordial in the pinnacle, or give it the most importance for us to see the result happening in the time constraint that we have or we wish. So we never give them any time constraint over here. You will see the change in 10 days, 15 days, 30 days. All that we tell them, if you stick to our lifestyle change, our supplements that we give, and the sleep pattern, your whole diet, everything put together, you will see the change. Don't just depend on, okay, sir has given me the medication, everything is going to take care. But you will be taken care if you're following it in the form that we are giving in. Change yourself from inside out, your thinking, your lifestyle, your diet, what you've been eating otherwise, and follow the medication that we give. You will see the change. And parents who have followed incomplete have come back to us and they've said, we have seen the change And you've been a God in our family. And for me to hear all this, no, it's not movie, it's real time. So I have seen it with my own eyes. I have gone with them in this journey. And sometimes when they ask questions, I say, ask questions for which you will have answer. Parents have asked, mothers have asked, especially, did I do something wrong? I didn't breastfeed my child. I felt my career was so important. My child was only bottle fed and he was given only supplements like Farex. Did I make a mistake? They go in a guilt mode. Even to talk to such mothers and bring them on board, because being in a negative mode of guilt mode is again not going to help us. So we can give them the benefit of doubt and tell them, don't go into the guilt mode. Past is past. Let's do what we can that's best with what we have now. Catch them young. So that's our policy. And we call it as the golden age. Any child coming into us at the earliest. With this, I give it back to Sir. Thank you, sir.
Thank you. Thank you so much, Prasanna. Ladies and gentlemen, and I consider this core group as an opportunity for us to spread the message. I apologize if we have painted a very big canvas. When you said about autism care, I think we have loaded you with a lot of information. And because, like Pawanji, he looks at every individual or every medical person as a potential candidate for this webinar. Having lived with children with autism, now happy that early biological intervention is paying dividends. I am looking at the outside society in which many children who are called neurotypically normal, even young girls and young adults, not able to respond at the first name call, not able to tell an answer in the first attempt. Now, there is evidence to show in the media that the attention span of everybody is coming down. The messages are seen within 5 seconds, they skip. They don't understand the message. They don't respond to the message. They make spelling mistakes as if it is the right to do. And it is slowly erupting into the society. And we are all Ayurvedic physicians. I mean, we are not, I am not. Anyway, I'm into the science of Ayurveda. I'm not an Ayurvedic physician. See, slowly, if it is happening, we talk about peace, but look at our movies. The movie with the wildest violence rakes in 600 crores. See, I'm not politicizing the whole thing. I'm using this forum to spread the message. Will it not affect the society? If a 4 months pregnant lady goes to a movie theater of such nature movies, will it not affect the fetus? She doesn't realize the fetus is crying all the 3 hours she is inside the movie hall. I am worried that person can give rise to an autistic child, which will be difficult to manage. When I see a pregnant lady using her tummy as a mobile phone holder and then typing and then seeing Instagrams, I cry inside for the fetus, who is possibly exposed to that damage from the mobile phone. And such way, it is rampant. There are children with autism. There are children, normal children, converted into autism also. See, we are seeing children using tablets. The mothers feed them food looking at the tablets. And that brain can or those cells can transform into autistic kids, and we are seeing that happen. In all this, we wanted to present to this audience. That is why we were over enthusiastic in presenting so many facts to you. And then I think these facts are not beyond your understanding realm. Everybody would have understand the whole thing. And we were happy that Pawanji took care of us, who are taking care of us. So thank you so much for presenting to the audience to us. And then on behalf of Prasanna and me, we think that we have done justice to Pawanji's confidence. Thank you so much.
Thank you. Thank you very much, sir. So nice of you. Both of you. Thank you very much. Now, Agnihotri sir session is open. If anybody would like to ask any question, he is welcome. Agnihotri sir. 10 to 15 minutes only.
Thank you. Thank you, sir. Thank you so much. And really, I thanks Professor Dr. Karthikeyan Netarajan sir for his very likely comment over us all that we are all to some extent autistic. this is what.
Don't take it on the offensive.
This is why I got me, especially when we are confining with our webinar for last 3.5 years. Thank you, sir. Thank you so much. To be passionate over any object or aim leads to some such situation, knowingly or unknowingly, that will take place. Thank you, sir. Thank you so much. And now we have got a number of our guests in our platform, having different sites and sectors over this issue. So I've been allowed to invite.
Before anybody, I would like to request Dr. Pranjal Joshi. Namaskar.
Dr. Agnihotri sir, namaskar. Dr. Harish from Jodhpur. And I want to congratulate for the organizers to organize such a wonderful event and sharing the views of the Natarajan sir and his display. Sir, my one question is that which type of the therapy you are providing at your clinic, sir, or at your center? Because whatever the conversation was going here, and there is a multiple disciplinary approach is utilized in the treatment of the autism or the ASD children. And
sir, your voice is not heard. Hello?
Diagnosis is not so easy because the child, even after the 18 months of age, if an pediatrician is very efficient, then he or can make the diagnosis of autistic child. In that age group,
Sir, your voice is breaking. Hello?
In the treatment of autism. Sorry,
sir,
for
we missed some of your questions, some form of your questions. Hello, we are missing you now.
Is that in the initial age group, the diagnosis we find, what are the modalities to treat the child ASD?
See, the thing is, I'll answer your first part of the question, like how do you diagnose? See, there are several red flags, and the red flags appear early. So you will be surprised that the questionnaire in which we ask a question for most of the mothers: did the child look at your face when you were breastfeeding? We found that most of the mothers said negative. And a mother with a normal child earlier has the confidence to say that no, it didn't, this child did not look at me. So like that, arching backwards, and then index finger pointing, toe walking. There are several parameters with which you can tell this child is autistic, so that we make an early thing. Once we make an early diagnosis, I'll put it in a nutshell. I told you the mind is in the cell, and the cell is in the brain also. So we are all made up of a robust molecular architecture. a neurotypically normal individual. These children, because the history goes with single gene, multigenetic, and all this kind of arguments, what I will tell you is like we are all robust molecular architecture. The child with autism does not have the robust molecular architecture, so it is susceptible to the environmental toxins. So everybody eats junk food. Why should these children get affected? Because they do not have the robust molecular architecture. So what we do is, see, there is a toxin release which affects the brain. So to control the toxin release, I take away the stressor. Do you get my point? So you have a gene which is expressing a bad protein. So to control the gene, I take away the trigger. So this is the essence of my treatment. So when I correct the diet, offending diet, because we are all going on an evidence-based platform. There is a evidence to prove that these children have inflammatory bowel disease, and the inflammatory bowel disease produces cytokines, and the cytokines damage the blood-brain barrier. Then only the neuroglia gets affected. Then only the functional problems happen. It is all there, but if you want to wait for the perfect answer will not come. We have taken the good enough scientific findings and then worked on it. So do we have a perfect answer for diabetes? Do we have a perfect answer for hypertension? Do we have a perfect answer for cancer? We don't. We deal the good enough. So that is the approach, and that is the broad answer that I can give you. The simple nuances we are willing to teach you. And we are in bigger center now in Bangalore. If you want, you can approach us. We will be happy to teach you. And then we are happy to, as Prasanna said, pass the baton to many people so that millions of children gets benefit. Do I answer your question?
No, I am not getting my answer, sir. Because I am an associate professor in the Department of Pediatrics, and I am also treating the autism patients here. I want to ask just what are the treatment modalities are you using in your center? Because you are not...
we use a diet correction.
Celebrating that, sir.
No, we do a diet.
Because I know that there are a lot of therapies should be involved in the treatment of the autism. So therefore, I want to know which type of the treatment are utilized to give the relief of to the children, because the emotional support is needed. If we create an emotional support to the child or in the family, then definitely the child will improve. Along with that, we have using the cognitive behavioral therapy, a lot of occupational therapies. We used, and definitely the child will improve. And in the many cases, I see all this. The child improved, the poor eye contact will retrace back, and the other social interaction will increase. So I want to know which type of the treatment, especially you are using.
We are using dietary correction. We are using yoga. We are using ovulation therapies. We are taking the children away from the gadgets. And to put it much more simpler to you, I consider brain as a hardware, and then it is inflamed. That is why it is not taking the software, which is the learning method or the emotive support that you are mentioning. So if I correct the hardware, it will take any software and then it will become better. That is the broad view that I can give you. And then if you want the nuances, then we can email and then learn about the nuances we can share. Without offense, I make this statement, all this emotive approaches, ABA and other things are outside in technique. My technique is inside out. So when I correct the molecular denominator, the molecule becomes better. Once the molecule becomes better, the tissue becomes better. When the tissue becomes better, the organ becomes better. That is why I told you, all these methods which I give to the primary affected organ, which is the gastrointestinal system, the secondary affected organ or the neuroglial inflammation becomes better. It increases the neuronal coherence. When the neuronal coherence increases, My children speak without speech therapy. My children button their shirts without occupational therapy. My children fill up the bottles to the brim without spilling, without occupational therapy. My children run a lemon and spoon race without occupational therapy. My children sleep better. They defecate every day. They indicate this thing, and we are able to successfully take away the diapers within 3 months of our therapy. And taking away the diaper in a child with autism, you should understand what pleasure it will bring to the mother. You should know that even children of 10 years age run with diapers because they don't indicate toilet training. So in essence, I do an inside-out technique, and I want to propagate this inside-out technique. And I prepare the soil for the OT or speech to become better. You understand? That is in essence. Yeah.
Thank you very much, sir.
Thank you. Thank you.
Thank you very much. Both of you, thank you very much. Now I would like to request Dr. Pranjal for 5 minutes. He wanted to share his experiences with autism, but time is only 5 minutes, 5 to 7.
Yes, yes, sir.
We have to
Yes,
shift
sir.
to next webinar.
Yes, sir. I just want to put some of the points related to physiotherapy, role of physiotherapy in autism. Myself, Dr. Pranjal Joshi, I have pursued my master's in musculoskeletal and sports, currently working in Sports Authority of Gujarat. मैं ये जो है ऑटिज्म इस चीज पे इसलिए बोलना चाहता हूँ क्योंकि मैंने बहुत सारे ऐसे
I don't follow Hindi, please.
सिविल हॉस्पिटल अहमदाबाद जो है असरवा, उसके अंदर मैंने काफी सारे ऐसे पेशेंट्स देखे हैं जो
in English, please.
I have seen lot of patients in civil hospital Asarwa, Ahmedabad, affected by autism, and in which I have given them so many physiotherapeutic treatments which help them to enhance their performance. Like we can give patients suffering from autism, we can try to motivate them to do such activities which are related to physical activities, like physical exercises. If a person affected with autism tries to enhance their bodily activities and muscle performance, the patient may achieve a good body posture as well as psychological state.
Your voice is not heard.
आपका mic mute हो गया है, please. Yes. Okay.
Am I audible?
Yeah,
Now you are audible.
So we can give them the for achieving the milestones, we can give them specific tasks, such as we can train them doing hydrotherapy, which is also we can train them to do swimming. We can train them to do some specific sports activities which enhances their psychological milestone and improves their bodily functions. So to improve the muscle strength and body stability, we can also give them specific tasks like such as self-defense courses, self-defense classes. We can also put them in specific games, but to be assured, the parents should be there during their any physical activity, because the patient suffering from autism is highly reactive. This is the basic point which I want to add on. And thank you for giving me this platform. I'm glad to present some of the points regarding physiotherapy on this platform. Thank you so much, sir.
Sir, can I add some point to his observation?
Sure.
Dr. Pranjal Joshi, I think I pronounce your name right. And I do agree, but I have a different point of view. When the child with autism is now known to have neuroglial inflammation, it is also known earlier to have musculitis, fasciitis, tendinitis. And these pains and cramps they suffer in the night. these pains are not expressed by the child. And that is the reason why we have to kind of motivate a child to do that. But if we are able to take away the cytokines from their system by whatever you said, swimming, hydrotherapy and all that, it builds in endorphins. But the intestinal toxins pervade everywhere and then they cause inflammation. That is why oleation therapies are very comfortable to these children. The children refuse to climb to the oleation table on the first day. The second day and third day, they cooperate for our oleation therapy for more than 45 minutes. That is because the oleation therapy improves their synovial joints, synovial membranes, and the tendinitis and fasciitis and musculitis come down. I have actually asked many physiotherapy people to work along with yoga people to know how mutually both are helping. See, because they share a lot of, it is only a joint movement, but in autism, it is much more beyond the joint movement. You just don't have to motivate a child. The child will understand which therapy of yours or which treatment of yours is making her joint flexible. And we have seen it in yoga. They go from a passive stage to following a command stage. And all this is there because the interest of me and my team is to propagate this science to physiotherapists and occupational therapists. And it is just not the divide of small muscle and large muscle groups. It is the understanding of biological inflammation through the cytokines which these autistic children are producing. And many of the normal people are also producing cytokines, but we are able to express that we have pain. The autistic child does not have the verbal ability to express that. We have to understand. That is why the science that we have developed is an inside-out technique. Thank you.
I agree, sir.
Thank you very much. Thank you. So now I would like to request Professor V.K. Agnihotri, sir, to conclude the webinar. We are going to shift this webinar to next day.
Thank you. Thank you, sir. Thank you.
Vote of thanks.
Yes, thank you, Professor Sharmaji. And it's our great pleasure that today evening we got such a great learned person having a great experience on this autism and autistic cases of children, Dr. P. Natarajan, Karthikeyan Natarajanji. He actually shown all the possibilities to become an artistic person at the same